folks, I'm Wound Care Karen. I love being a nurse and I have a passion for wound care. I want to inspire nurses, educate patients, and have a little fun along the way. Today, we are going to talk about different certification pathways in wound care. And first, let me clarify. I live and work in the United States, so this is specifically about what is available in the US. I cannot speak to other countries. First, let me tell you a little bit about my wound care experience. I graduated from a diploma program from my local nursing school and became an RN in 1994. At first, I worked in a nursing home where I saw a lot of wounds. Until about 2002, that's when I got a job in a hospital. In 2003, a position opened up in our hospital's wound care / ostomy / hyperbaric department, and I moved into that job. It was there that I realized I love wound care, and I started learning more about the different wounds, different dressings, attending wound care conferences. I mean, I was just like a sponge, just soaking it all up. In 2005, I became a clinical nurse manager of an outpatient wound care clinic, and I've essentially been doing that role ever since. In 2007, I got my first certification when I became certified in hyperbaric oxygen nursing. So I got my CHRN, Certified Hyperbaric Registered Nurse. And then in 2021, I became certified in wound care. So I also have my CWS, Certified Wound Specialist. As a nurse manager, and also as a member of different wound care forums on Facebook and other social media platforms, I often get asked, how can I get certified in wound care? But it's not a single simple answer. There are a lot of options, and a lot of them depend on your educational background. So it's different if you're an LVN or LPN or a diploma RN like I was, or if you have your bachelor's, or even if you're a physical therapist or an EMT or a nursing assistant, etc. Now, the good news is there are wound care certifications for just about every healthcare position you can think of. There are certifications for doctors, nurses, nursing assistants, physical therapists, occupational therapists, therapy assistants, registered dietitians, and even for marketers and vendors in the industry. Now next, and please hear me out on this, I really think you need at least 3 years of wound care experience before you consider certification. In fact, many of the certifications that I mentioned require at least 3 years. Now, there is no shortcut to experience. You cannot take a weekend class and become an expert in anything. Having certification in a specialty means that you are an expert in that field. Think back to your first 3 years in your field. Whether you're a nurse or a physician or a physical therapist, were you really an expert in anything in those first 3 years? No, right? I mean, you're still learning just how to be a nurse or a doctor or a therapist. You're learning how to properly assess patients. You're learning new clinical skills. You're learning about reimbursement and documentation. I mean, it's overwhelming. I love this quote from Nora Ephron. Looking back, it seems to me that I was clueless until I was about 50 years old. Now, what do we mean by wound care experience? Well, it's just that. Wound care experience means that you care for and treat wounds. So, for example, when I mentioned that I worked 9 years in long-term care, I also gained wound care experience during that time because, although we were blessed much of the time with an awesome treatment nurse, I worked evenings and weekends. And so as the nurse, I was responsible for changing dressings, assessing wounds, applying Una boots, notifying the doctor when the treatment wasn't working, etc. So don't sell yourself short. You may already have wound care experience under your belt if your work entails anything to do with wounds. If you are a registered dietitian working in a hospital and you help calculate the caloric and nutritional needs of patients with wounds, you have wound care experience. If you're a home health nurse, oh honey, you have wound care experience. If you're a nursing assistant and you help the nurses change the dressings, guess what? You have wound care experience. So next, you need to consider, based on your education and based on your level of experience, which certifying body to get your certification through. Now today, I will discuss 5 different organizations that offer certifications. There are more out there. This list is not all-inclusive, but I'm mentioning what I consider the top 5 most popular organizations. Again, it's just my opinion. Please don't send hate mail. Now, please don't feel like you need to grab a pen and paper and write these down. I'll include this list in my show notes of these 5 organizations and some of the certifications they offer. I'll list who qualifies, how much it costs, how long the certification lasts, etc. I actually wrote this list when I was considering my own certification pathway, and it helped me decide which one. And you can have more than one. You can be a WOCN and get your CWS and your WCC if you desire. But before I start, I want to clarify something. Please note that having a wound care certificate is not the same thing as a wound care certification. Now, what do I mean by that? Well, I've actually seen some wound care courses that advertise, at the end of the course, you'll get your wound care certificate. Yay! It sounds exciting, right? But honestly, all it means is that you'll get a piece of paper saying that you attended the course and earned some CEUs. That's not certification. You didn't earn any new initials after your name. So you're paying hundreds or sometimes thousands of dollars just to receive a piece of paper saying that you attended, which all courses provide, by the way. And you still have to pay hundreds of dollars to a certifying body to get a certification. So please be careful when you're shopping. As they say in Latin, caveat emptor, let the buyer beware. Please make sure you recognize the difference between taking a wound care course and taking a wound care certification exam. Okay, so I'm going to review several different wound care certifications. I'll discuss who is eligible, what certifying body provides the test, the type of experience required, the cost of the exam, and how long the certification lasts. Now, these are in no particular order. There is no certification that's better than the other. You have to pick the one that is right for you. So I'm just going to pick one and get started. Let's see. Okay, let's start with VOHRA. That's spelled VOHRA. You'll find them at VOHRAwoundcare.com. They're actually more than just a certifying organization. They're a quite large physician wound management group, and they offer online courses. They offer services in skilled nursing homes and even a wound care app. They do offer wound care certification for LVNs and LPNs, RNs, nurse practitioners, physician's assistant, nursing assistants, doctors, physical therapists, occupational therapists, and medical assistants. One cool thing about VOHRA is that it's one single fee for both the training and the certification. So it's currently $650. It gets you 30 CEUs. You get unlimited attempts at passing the test, and you walk away with your VWCN, and that's trademark. That stands for VOHRA Wound Care Nurse. More good news, this certification remains active forever. There's no need to renew, and there is no renewal fee. Now, there is actually no experience required to take this test, and you know how I feel about that. But that actually makes this a good first step for those newer to the field of wound care. Many skilled nursing facilities actually purchase their wound management program, and then they're able to offer this training and testing to their staff. And I think that's a good thing. The more education about wound care, the better. Okay, next, let me talk about the ABWM, the American Board of Wound Management. The ABWM is a voluntary, not-for-profit organization that was established specifically to provide credentialing to professionals in wound care. This certifying body has several certifications available, including the CWSP, the CWS, that's the one I chose, and also the CWCA. Let me explain the differences. The CWSP stands for Certified Wound Specialist Physician, and it's for MDs, doctors of osteopathy, and DPMs, that's Doctor of Podiatric Medicine, a podiatrist, with 3 years of experience. Now, it's not a training program. This is a test for certification. The cost for physicians is $995 and then $150 annually, and you must maintain 6 CME per year in wound care to renew. Now, after 10 years, you must recertified. You basically start the whole process over. Next up is the CWS, and that stands for Certified Wound Specialist, and it's available for RNs, physical therapists, physician's assistants, nurse practitioners, or doctors or podiatrists who have at least 3 years experience. The test costs $575 and then $150 annually to renew. And again, you must complete at least 6 CEU every year in wound care to renew. There are 150 questions on the exam, and the recertification process starts again after year 10. The CWCA stands for Certified Wound Care Associate, and this is for LVNs or LPNs, RNs, nurse practitioners, PAs, physical therapists, physical therapy assistants, OTs, occupational therapy assistants, doctors or podiatrists, or even sales professionals, again, with 3 years experience. There are 120 questions on the exam, and it costs $375 initially, and then $150 a year. And like the other 2 certifications, it lasts for 10 years. And also, you must continue to earn 6 CEUs in wound care every year to maintain annual certification. Okay, next up, let's talk about the NAWCO, the National Alliance of Wound Care and Ostomy. This is also a not-for-profit voluntary organization whose mission it is to develop and administer a certification process of the highest standard to measure knowledge master of wound care and ostomy management. It's right from their website. The NAWCO actually offers several different certifications specific to diabetic wounds, nutrition, ostomy, and lymphedema. But today, I'm just going to focus on the wound care certification, the WCC. WCC stands for Wound Care Certified, and those eligible include LVNs and LPNs, RNs, nurse practitioner, physician assistant, physical and occupational therapists, physical and occupational therapy assistants, physicians, or podiatrists. Now, you must either A, graduate from an approved wound care course, or B, already have your CWS or CWOCN. Okay, so you have to fall in one of those 2 categories. Then you must either A, complete 120 hours of clinical training with an approved preceptor, or B, have 2 years of experience in wound care. That's if you're full-time, 4 years of part-time experience in wound care. So again, one of those 2 pathways. The test itself is 110 questions, and it costs $380 and lasts for 5 years. If you fail, you can retest, but it costs the whole $380 again. The recertification lasts 5 years, at which time you have to retest to recertify. Next up is the Wound Ostomy Continence Nursing Certification Board, the WOCNCB. They offer many certifications for nurses. You may have heard of Certified Wound Ostomy Continent Nurse, the CWOCN, or any of its combinations. CWON, that's Certified Wound Ostomy Nurse, the CCCN, that's Certified Continence Care Nurse, etc. They also have a Certified Foot Care Nurse, CFCN, available. To be eligible, you must have a bachelor's degree, and then you choose one of 2 pathways. The first pathway involves taking a WOC education program, such as WebWalk or Emory. These cost about $2,500. And then you pay the $395 testing fee, and the certification lasts for 5 years. The other pathway is experience. If you have had your bachelor's for at least 5 years and you've earned at least 50 CE plus 1,500 clinical hours in the past 5 years, you are eligible to take the test. One cool thing about the CWOCN is that you can actually train other associates and help them achieve certification. This certification is eligible for LVNs, LPNs, physical therapists, and RNs, and it's called the WTA-C. It stands for Wound Treatment Associate Certified. The hospital or facility must purchase the program from the WOCNCB, and the CWOCN nurse hosts it. And so you can actually set the price that you want to charge, such as $150 or $250, and you can make some money and train colleagues. The last certifying entity that I'll mention today is the American Board of Wound Healing, the ABWH. They offer certification in wound care as well as hyperbaric medicine. One of their certifications is called the CSWS, Certified Skin and Wound Specialist. And this is for LVNs and LPNs, nursing assistants, medical assistants, EMT, RNs, physician assistant, nurse practitioner, doctors, podiatrists, physical therapists, and more. To be eligible, you must have a minimum of 2 years experience in a hospital or an outpatient facility in wound care, plus completion of 20 CEU in wound care. The test has 135 questions. It costs $320, and certification lasts for 5 years. Okay, now that I have mentioned some different certifications and certifying bodies, let's talk cost. Earning and maintaining certification can really add up. It's not for the faint of heart or the light of wallet. But fortunately, some employers may be willing to reimburse you for your efforts. Sometimes they will even pay upfront to provide the prerequisite education. Every employer is different, so don't be afraid to ask. Also, some of the different certifying bodies offer discounts and even scholarships. Shop around and compare. Now that we've discussed cost, let's talk format, and let's break it into 2 parts: format for training and format for testing. For training, there are a lot of companies that offer online, self-paced format. There's just a few brick-and-mortar schools. If you don't prefer online, please note that there are a myriad of study books, note cards, testing guides, and more that you can purchase. And have fun with it. I'm a firm believer in having fun with learning. So at my wound clinic, when one of us is studying for certification, we do flashcards with each other at lunch, or we ask each other questions from the study guide. Now, testing. Much of the testing is online, but a few of the tests are proctored. So you either have to attend a proctored testing center, such as Sylvan Learning or Person View, or have a setup at home that has a camera and microphone so that you can be proctored online. And you can research all of these options on the company's website when you're investigating the specific certification. So I hope you have a better picture of the different pathways available for wound care certification. Be sure to check out each certifying body's website for more details and information. Today, I just painted in broad strokes. And like I said, there is no one perfect certification. Sometimes when I see the question asked on the forums about how can I get certified, someone will answer, well, the gold standard is the CWOCN. And that's actually their marketing tagline. Check out their website. You'll actually see it at the top of their logo. Quote, the gold standard of certification, unquote. And it's a registered trademark. They actually registered that with the trademark department so that no other company can say they're the gold standard of certification. Now, I certainly don't mean to poo-poo them. They may consider themselves the gold standard for those who have had their bachelor's degree for over 5 years, or for those who can afford the $2,500 walk program. But what about the rest of us who don't even qualify for the test? How can something be the gold standard for you if you don't even qualify for it? So I just encourage folks to keep an open mind, recognize the diverse environment of not just nursing, but of all of our allied healthcare professionals. I mean, it takes a team, right? So there's no need to disparage other people's goals or pathways. If we all share a passion in wound care, we should be lifting each other up instead of trying to make one feel inferior or lesser than because of their background or level of education, right? Let's just spread kindness. Also, as a hiring manager, I can tell you that having any certification in your specialty is a plus. If all things between two candidates were the same and one had certification and one did not, I would choose the one with certification because it tells me that they have motivation and chutzpah. So go for it. And like I always say, never stop learning. Folks, this podcast was recorded in my studio on the hill in San Antonio, Texas in December of 2022. It was developed, produced, and edited by yours truly, Wound Care Karen, and I did it all while making a batch of sourdough bread. The views expressed here belong to me and not my employer or affiliates. If you like what you heard, please subscribe and give me a 5-star review. If you have ideas for future podcast content, please drop me a line at contact@woundcarekaren.com or message me on Facebook, Instagram, or YouTube. I'm Wound Care Karen, and please remember, folks, time does not heal all wounds. So if that happens to you, please seek help from a certified wound care professional.